Cron 4, your mind, body, and family with Dr. Mark Steinberg.
And time once again for our weekly segment on how to maintain good mental health. And joining us this week, as he does every week, is Dr. Mark Steinberg, who specializes in clinical, educational, and neuropsychology. Dr. Steinberg, thank you so much for joining us.
Hi, James.
Now, today we're going to be talking about psychopharmacology. And just real quickly, that is the practice of prescribing
Drugs for mood control, state control, mental things, attention, sleeping.
Now, it's not always effective.
Right.
A lot of drawbacks to it. So I guess my question is, with that, why is it so heavily practiced? It's pretty common for doctors to prescribe, just write a script.
It's very common. It's common for everything from attention deficit disorder to sleep. In my routine interviews of patients, I always ask, how do you sleep? And many of them reflect and they say, great, with Ambien.
With Ambien.
So the question is, why are they so prevalent? Why are they so heavily prescribed? Well, we need to look at two factors. One is physicians are trained in medical school, and they are medical doctors. But there's a vast difference between prescribing antibiotics for an infection and prescribing what amounts to narcotic medications indefinitely for mood control or waking up or going to sleep or paying attention. The second reason they're so prevalently prescribed is that they're relatively inexpensive when they're generic, and the pharmaceutical companies market them very, very heavily.
Yeah, I'll bet. So for people who are on medication, and maybe it's not working so well, I guess the point that we need to get across here is there is an alternative.
Oh, yes. Oh, yes. It is 2010. People are on many medications, so the viewers should know that we work with people who are on medication. Sometimes they get off medication. Oftentimes they lower their dosage. That's between them and their physicians. But we have treatments that can reduce the need for medications and get people much better even if they're on medications. We're talking about treatments that self-regulate the brain, that reduce the need for heavy medication or the intervention by pharmacological control, because the brain regulates these moods. You know, the idea that you have a chemical imbalance is really kind of a straw horse, because what we treat is what causes chemical imbalance or chemical balance, regardless of whether you were born with it.
Wow. And I guess, I mean, the downside, obviously, of pharmaceuticals is you're on them for the rest of your life.
That's right. They have side effects. They have increased tolerance. You need to use more and more and drugs to control them. But with our treatments, they're very natural. People can get rid of addictions. People can get rid of depression and anxiety. And it really works.
Wow. Well, find out more if you can. It's easy to get a hold of the doctor on his website, marksteinberg.com, his email, mark@marksteinberg.com, or give him a call, 408-356-1002.
This segment is sponsored by Dr. Mark Steinberg.